So you've done the IVF process, you've taken all the drugs to hopefully collect all your beautiful eggs, which have now been fertilized with the sperm, and hopefully you've got some gorgeous embryos that are now ready. And in fact, one or two of them might now have been transferred, either in the form of a fresh or a frozen cycle. Now, if this is you, you've gone through the embryo transfer process and now you're in the 2-week wait. And these are 2 weeks that are most probably the most stressful 2 weeks of your entire life. For most women, this is a time when they're driven to absolute distraction. It's so hard to actually wait during that entire period, which might be slightly less depending on when you've done your embryo transfer. Always make sure with your doctor as to when they want you to come in and have that blood test done. But it still feels like a really, really long time, and those 2 weeks can often feel like months of waiting. However, what I want to do is guide you through that process and guide you through what scientifically and medically some normal things that you might experience are. So trying not to get you over concerned or worried about any symptoms that you might experience, and then also give you some tips as to how to handle that wait, because it is an anxious time and it's a really difficult time that there's no way of getting around other than trying to make it as comfortable and as compassionate for yourself as is possible. So the first thing I want to talk about are abdominal cramps. Some abdominal or tummy cramps that you might get are entirely normal. So it doesn't necessarily mean that there's anything wrong or that you might be miscarrying or that the embryo hasn't implanted. This isn't the case. The cramps can come from something as simple as ligamentous or muscular pain that you might have sustained from the actual egg collection. And this is particularly so if you've had a fresh transfer. So the transfer's happened only a few days after your collection, and in particular if you've had lots of eggs collected as well. Or it could be a side effect from some of the drugs you've taken during the IVF stimulation process itself. The other thing that can be fairly common is some light spotting or bleeding. Again, a lot of women might jump to the conclusion to think that there's something immediately wrong, and I completely understand that. But actually, most of the time, this can be entirely normal and is, in fact, in certain cases associated with implantation. So when the actual embryo implants into the wall of the uterus. The other thing that you might experience are all the symptoms that are typically associated with early pregnancy. So things like nausea and tiredness, that's a big one. A lot of women might feel incredibly tired during the 2-week wait. And that can often be, again, as a side effect due to all the drugs that they've taken during the stimulation process itself or the IVF procedure. So again, doesn't necessarily mean anything is wrong at all and could in fact be a good sign that things are occurring and unraveling as they should. A common misconception that a lot of people have is that they're not allowed to do very much after the embryo transfer. So traditionally, women were told that they needed to bed rest for sometimes the entire 2 weeks of their wait. And this is absolutely not the case anymore. Lots of research has been done to suggest that actually bed rest alone can be completely counterproductive. And in fact, the most important thing is to go about your normal life as you normally would. Not only will this help to distract you and also preoccupy you with something else and stop you from over worrying about certain symptoms and doing a necessary pregnancy test, but also it's really important to mobilize during this time because too much bed rest can also put you at risk of deep vein thrombosis and things like that. The other misconception is that you're not allowed to have sex after the embryo transfer. Now, there is some conflicting opinion about this, and certainly traditionally most women were told to abstain from sex and that this wasn't any good and then they might sustain an infection as a result of that. And so traditionally most women didn't have sex during this period. In fact, the newest research is suggesting that having sex after your embryo transfer could in fact be a positive thing. And this is because it's believed that sex can induce an orgasm, which can therefore increase certain contractions in the uterus that can be very productive and helpful in terms of aiding the embryo to implant. So in fact, sex could be beneficial not just for you and your partner to relax and to return to a sense of normality and also keep your stress levels down, but also could be beneficial for the implanting embryo as well. So you've been told it's absolutely fine to have sex if you want to after the embryo transfer. Certain things that we should be aware of are foods that we need to be eating. So generally speaking, you all know I'm a fan of the clean food movement. So trying to keep things as clean and as unprocessed as possible. Trying to eat things which are as nutritionally dense as possible. Lots of fresh fruit and veg, and as organic as you can be during this time, which should be the case pretty much in the lead up to you having any treatment, and also afterwards and in your pregnancy too. Try and have a toxin-free environment in your home. It's really hard to have that outside when we're afflicted with so much pollution, especially if you live in big cities and towns, but trying to keep your home as toxin-free as possible. So be mindful of the products that you're using on yourself, around your home, in the kitchen, you're using to clean with. All of these things could be endocrine disruptors, so could contain synthetic chemicals that could in fact be quite dangerous and cause symptoms and things that we don't necessarily even know about. So really important to try and be as natural as you can be during this time. Also important in terms of food to avoid things such as raw meat and raw fish. So I'm afraid no sushi for those of you who are lovers out there. Making sure the eggs are hard boiled as well. And also just trying to take any of the supplements that you've been on as well that are absolutely important. So things like extra iron if you need it, making sure you're still on folate or folic acid, which is important to protect the baby from neural tube defects as it's growing and developing. So continuing all the multivitamins and the supplements that you've been on is really important, and making sure you're getting lots of antioxidants from your diet and from the supplements as well. The other thing to bear in mind is that you don't want to introduce anything that's too hot around your tummy area. So keep away from hot water bottles and hot baths. Try and have showers instead, or use only lukewarm water if you are going to go in the bath. And don't have any laptops on your tummy or any mobile phones there as well, because due to the electromagnetic radiation and the fact that phones can heat up, they can also introduce warmth around that area. So make sure you don't do that. Try and avoid heavy lifting as well, which you should be anyway. And exercise is another big one, and an area with a lot of misconceptions. So again, traditionally, women were told that they shouldn't exercise in the 2-week wait. I think this is absolutely counterproductive. In fact, if you are a woman who likes to exercise regularly, it's really important that you continue to do that. And exercise, in fact, will help to improve the blood flow to the ovaries and to the womb, could potentially aid implantation that way. So really important that you are active, just making sure that the exercises are more gentle and more antenatal and nothing that can lead to impact on your tummy. So make sure you do continue that. You can absolutely do that up to about 150 minutes per week. But if you're not sure, always go and see your doctor and have that chat first. And then there are other things to try and keep your stress levels down. So I'm a big fan of all sorts of different holistic treatments to help with this. So things from hypnotherapy to reflexology, to Reiki, to crystal healing. Acupuncture is another great one, and the other benefit of acupuncture is that it's also been shown in some studies to help to improve the blood flow to the pelvis, and again could help to aid implantation that way. So whatever it is, whatever you're into, try and explore that, give it a go. It's particularly important to try and keep calm during this period of time, and also keep the stress levels down to as much as you can. You don't want to be overproducing the stress hormone, which is cortisol, because that in itself could potentially have negative effects. So try and do as much as you can to preoccupy your mind. Be compassionate with yourself during this period. Be patient with yourself. And remember how hard you've worked to get to this point. If you do need some help, if you do need anyone to turn to for support, please absolutely make sure you reach out to friends or family or even a counsellor. There are so many brilliant people who are so well trained in supporting women going through all of this, especially if you face a very difficult course getting up to here. There's so many super platforms out there on forums and social media and various different networks. Make sure you access them all, because there's loads of information there and loads of people who want to help. I wish you so much luck and lots of baby dust your way.